Welcome to Doctor to the Garbage Pail Kids, the single best way to learn medicine after an accredited medical school has turned you down. I'm Matthew Tortora, and I'm a board-certified pathologist, and in this series, I'm going to diagnose the aches, pains, and other ailments of the characters from that all-at-once beloved and reviled 1980s trading card series, The Garbage Pail Kids. But before I begin, a quick disclaimer that the content on my site is for educational purposes only and does not substitute professional medical consultation from your actual doctor. If you'd like some general background information on what the Garbage Pail Kids are, feel free to check out my teaser installment listed in the links below. Otherwise, sit back and enjoy the course. Today we're going to talk about Fat Matt. Released in 1985 as card number 26 of the first series, he's one of my favorite Garbage Pail Kids. Fat Matt has a big problem. He's obese. I would say he's suffering from obesity, but by the look on his jolly face, he's not suffering at all. According to the WHO, obesity is a chronic, complex disease defined by excessive fat deposits that impair health, and it's no laughing matter. It's a global problem, affecting 1 in 8 people worldwide, and it's associated with myriad chronic health problems, including diabetes, heart disease, cancer, joint disease, sleep disorders, and reproductive health. Although it's easy to tell that Fat Matt is obese at a quick glance, it's important to know how obesity is calculated. In adults, obesity is defined as having a body mass index, or BMI, of greater than or equal to 30. So what is a BMI? It's a number, generated by dividing one's weight by the square of one's height. Doctors can then use this number as an indicator of how healthy one's body weight is. If your BMI falls between 18.5 and 25, your weight is considered healthy. If it falls between 25 and 30, you are overweight, the precursor to obesity. And if it hits 30 or above, you're obese. There's also something called the SMART BMI, which incorporates other variables such as weight and sex into the equation. But we'll leave that aside for now. But for young children like Matt, according to the WHO, obesity is not based on BMI, but rather as a weight for length greater than 3 standard deviations above the child growth standards median. With that in mind, let's prove that Fat Matt is obese by the numbers. To accomplish this, we'll need to know his weight, height, sex, and age, which will take some detective work. For sex, his name is Matt, so we'll go with male. For weight, the best clue we have is the scale he sits on, or rather what he's done to it. It's an analog scale, which means that it has a maximum capacity of around 400 pounds. We see that Fat Matt is heavy enough to exceed its capacity, as he's caused the face of the scale to rupture and fly off, along with the springs beneath it. Incidentally, he's also cracked the surface of the floor below. So it's safe to say that he weighs at least 400 pounds, or 181 kilograms. For age, we have some clues based on his developmental milestones. He's bald, or nearly so. The average age of hair growth is between 6 and 12 months. In addition, he's sitting upright, which happens at 6 months. And lastly, he's gripping not 1, but 2 large objects in his hands, which means he has the strength and dexterity of at least an 8-month-old. So in all, I'd put his age at between 8 and 12 months. For argument's sake, we'll say he's 12 months. And now that we have an age, we can use a growth chart to determine average height for an age of 12 months, giving him a height of just under 76 centimeters, or 30 inches. Now let's show where Fat Matt falls on that weight for length chart. At a weight of 181 kilograms and a height of 76 centimeters, not only is he above the 3rd standard deviation, but we need to extend the top of the graph to 7 times its current height just to accommodate his data point, making him the fattest baby to ever hobble across the face of the earth. So how did Fat Matt get so fat? With his wide eyes transfixed on their delicious prize, while his tongue wags like a dog, and a blob of melted ice cream sits unattended atop his gynecomastic bosom, it's clear that Fat Matt is addicted to food. Just how many calories are feeding this addiction? Let's look at what he's eating. A double scoop ice cream cone and a box of candy. According to EatThisMuch.com, his ice cream cone has 390 calories. For the box of candies, we don't know which kind, but comparing it to the box featured in the foreground of the card for Large Marge from the third series, a good bet is that it's chocolate, probably similar in size and content to a 22 candy assorted sampler box from Whitman's, which clocks in at 120 calories times 11 servings, or 1,320 calories for the box. Add the 390 calories for the ice cream cone for a grand total of 1,710 calories in just one sitting. The recommended daily caloric intake for a 12-month-old is 1,400 calories, and incidentally, it should come from a slow and steady stream of dairy, fruit, vegetables, grains, and proteins, as opposed to double-fisting an ice cream cone and an entire box of chocolates. In fact, it's not recommended that children under 2 consume any candy, particularly chocolate, because of the presence of added sugar and caffeine, which may explain why Large Marge and Fat Matt look so amped up. It is said that consuming as little as 10 to 20 extra calories a day can add 2 pounds of weight every year, although studies show that most suffering from obesity will consume far more than that. In Fat Matt's case, if he eats only what's in his hands every day, he will consume an extra 310 extra daily calories. But it gets worse. You've probably heard the phrase, not all calories are created equally. If we look at the nutritional content listed on the back of the Whitman's chocolate box, you'll begin to understand why. You'll see it contains 14 grams of sugar per serving, and from the ingredients, some of that takes the form of corn syrup. Corn syrup is an inexpensive commercially made food additive derived from corn. It contains sugars such as glucose and maltose. Although corn syrup is cheap and sweet, it's considered by some to be a metabolic poison. And this wretched substance is in everything, and it's making us all really fat. This is a chart showing United States obesity levels in adults over time. The rate is currently over 40%, and the levels have been rising continually, starting in the early 1970s, and that's not by chance. In 1970, one of the biggest global public health concerns was undernutrition. In 1973, in the spirit of this concern, and to retrofit New Deal regulations, President Nixon and his Secretary of Agriculture, Earl Rusty Butz, yes, that's his real name, introduced a farm bill, the result of which incentivized farmers to grow enormous amounts of corn. Much of that corn was turned into corn syrup, often in the form of a derivative called high fructose corn syrup, in which the more complex sugars are broken down further into the simpler, sweeter sugar, fructose. It was then sold to food companies as a cheaper alternative to traditional cane sugar. As if regular corn syrup wasn't bad enough, high fructose corn syrup is even worse for the body. And since then, American adults have been eating more and more of it and getting bigger and bigger. It's debated whether the rise in obesity rates is specifically linked to high fructose corn syrup, or whether the rise is due to a general overabundance of sugar. But in either situation, it is well established that overconsumption of processed sugar can and will lead to obesity one way or another, and something called the Metabolic Syndrome. According to the Johns Hopkins Medical Center, the Metabolic Syndrome is a cluster of risk factors specific for cardiovascular disease, which greatly raises the risk of developing diabetes, heart disease, stroke, or all three. The factors include abdominal obesity, high blood pressure, insulin resistance, the mechanism of type 2 diabetes, high triglycerides, a type of fat, and low HDL cholesterol, a type of good cholesterol. Studies also show that high fructose corn syrup is particularly hard on the liver, leading to a condition known as fatty liver disease, in which the cells of the liver are transformed into fat cells, a form of injury. This can be seen in these microscopic photographs of liver tissue. The photo on the left is of healthy liver tissue with uniform red-appearing cells, while the one on the right shows the liver from somebody with fatty liver disease, containing innumerable white circular structures which are fat cells. This can lead to permanent liver damage over time. And the liver isn't the only solid organ affected by obesity. So are the kidneys. In this microscopic photograph of a kidney from an obese patient, we can see two circular structures, a larger one on top and a smaller one on bottom. These are the filtration units of the kidney, called glomeruli. Here they are again side by side. The one on the right is small and scarred up, a form of damage, while the one on the left is big and fat as it tries to overcompensate for the underperforming damaged one. So fat Matt may have fat liver and fat glomeruli. Cultural norms have changed a lot since 1985. It's fair to say that today, mocking people with obesity, particularly children, is in poor form at the least. But I wonder if one reason why the artists who depicted Fat Matt were able to get away with it is that back then, in the 1980s, such cartoonishly large dimensions would have been so unusual that they could have only existed as a caricature. Although the rise in adult obesity rates started in the 1970s, for a while it seemed like young children were spared from this epidemic. But as sugary food continued to become cheaper and more abundant, no one was spared. As evident in this chart showing the alarming rise in childhood obesity rates since the 1980s, currently reaching over 20% in teenagers. It's worth mentioning that there are a few other causes of childhood obesity. One disorder, called Prader-Willi syndrome, is, as described by the National Institutes of Health, a complex multi-system disorder which features developmental delay and difficulty with appetite inhibition, which is sometimes so severe that the child is incapable of satiating themselves, leading to obesity. Although Prader-Willi is a serious disorder, it's important to be aware that it and other congenital disorders represent only a tiny fraction of childhood obesity cases. So now that we officially know that Fat Matt is obese, how do we turn him into Brett Sweat? The least intrusive way is to eat a balanced diet, which includes meats, fruits, and vegetables, and is low in processed sugars, particularly those made from corn syrup. Notice how I didn't say the easy way, because as it turns out, losing weight and keeping it off is hard, really hard. In fact, studies show that less than 20% of overweight or obese people who try to lose weight only through diet and lifestyle modification will be able to keep it off. Nonetheless, this would still be the best choice in the pediatric population. But in adults, there are cases where medical intervention may be indicated. Many tout Ozempic as an effective weight loss medication. However, it's important to note that Ozempic is indicated to reduce blood sugar levels in patients with type 2 diabetes and is not yet approved by the FDA solely for the purpose of weight loss, although its use to treat obesity is currently being investigated, and unfortunately, it must be given by injection. Ozempic improves blood sugar levels and reduces cardiovascular risk in type 2 diabetes patients by increasing insulin release, decreasing glucagon release, and inhibiting the inflammation that causes cardiovascular injury, and it suppresses appetite. Then there's surgery. The gastric bypass procedure, a type of bariatric surgery, is one of the most effective means of dramatic weight loss on a population level. And studies show that about 2/3 of patients will be able to keep the weight off 5 years post-surgery. Of course, after dramatic weight loss, the surgical removal of redundant skin may be indicated. Let's wind down today's session by wishing Fat Matt well on his journey back to health and summarizing the big points from our talk. Obesity is a growing worldwide problem. Childhood obesity is on the rise. It's associated with myriad health problems. Lastly, limiting sugar intake, particularly corn syrup, is paramount in preventing obesity. Thank you for joining me for this episode of Doctor to the Garbage Pail Kids. I hope that I've managed to teach you something about medicine while also rekindling your nostalgia for the 1980s. If you enjoyed what you saw, feel free to like, comment, share, and subscribe to my YouTube channel.